We're going to continue talking about the cardiovascular system, and in the previous discussions we talked about the major determinants of cardiac function being preload, afterload, and contractility. And in this discussion we'll talk primarily about afterload, which can be thought of as the wall tension or the resistance to shortening in which the left ventricle has to overcome in order to promote forward flow from the left ventricle into the aorta and ultimately to the systemic circulation. And we can think of afterload, or rather afterload, as the wall tension. If we were to look at the left ventricle, and although it's an elliptical or ellipsoidal type of shape, we can think of it as a sphere. And if we think of the left ventricle as a sphere, we can apply Laplace's law and say that the wall tension within the myofibrils, or within the ventricular wall, equals the pressure within the sphere, or the left ventricle chamber, multiplied by the radius of the left ventricular chamber, divided by the thickness of the ventricular wall, multiplied by 2. So we can take the pressure as a left ventricular end diastolic pressure, multiplied by the radius, divided by the thickness of the ventricular wall, which is multiplied by 2. And we can say that the wall tension with increased left ventricular end diastolic pressure, since it's in the numerator, increases the wall tension, or increases the afterload. And with increased wall tension, or afterload, we can say that there's an increased oxygen demand. And in fact, one of the things we talked about before, as far as increasing the oxygen demand, is wall tension. In regards to coronary circulation, we can say that there's an increased oxygen demand, and hopefully an increased oxygen supply that meets the demand occurs when there's increased wall tension, or increased afterload. And we can see here that when there's an increase in end diastolic pressure of the left ventricle, which is increased preload, it increases the wall tension and therefore increases the oxygen demand. So that shows a correlation between the preload and afterload, in fact the wall tension, and we can see that the heart compensates with an increased afterload with thickening of the ventricular wall, or it can be thought of as left ventricular hypertrophy, in which you increase the H value in the denominator, and by increasing this value, the ultimate tension, or the wall tension, decreases, and therefore there's a decreased oxygen demand. And we can see here that as you increase your left ventricular wall thickness, through the example of left ventricular hypertrophy, that tends to create a less compliant left ventricle, and therefore may lead to a diastolic dysfunction, for example, heart failure. So that's a clinical side note of how the heart compensates with an increased wall tension through a process of left ventricular hypertrophy. But we'll look at afterload from a more clinical standpoint and say that afterload can also be thought of as the systemic vascular resistance. And systemic vascular resistance can be thought of or equated to being the mean arterial pressure minus the central venous pressure, which is divided by the cardiac output and multiplied by 80. And the normal systemic vascular resistance generally is between 900 to 1500 dynes per second over centimeter to the 5th power. And an example, the same clinical example, can be systemic hypertension, in which you have vasoconstriction within the peripheral arterioles that increases the resistance in which the blood has to flow through these small arterioles, and that increases the resistance that the left ventricle has to overcome in order to promote a forward flow. And as we said, the example can be systemic hypertension, in which you have increased systemic vascular resistance, and ultimately that's why they have increased blood pressure, the mean arterial pressure. because mean arterial pressure equals the cardiac output multiplied by the systemic vascular resistance. On the contrary, you have an example in which you have decreased systemic vascular resistance, for example, septic shock, in which you have a decreased systemic vascular resistance, and that ultimately leads to a decreased mean arterial pressure, even though the patient may be in a hyperdynamic state in which the cardiac output is increased, for example, increased heart rate, but ultimately they're going to have a decreased mean arterial pressure in which they may require pressors, for example, levofed, which is norepinephrine that has the alpha and beta characteristics or stimulates the alpha and beta receptors within the cardiovascular system. So this was a correlation of afterload in relationship to wall tension and systemic vascular resistance. In the next lecture, we'll talk about the contractility and how the contractility has an effect on the cardiovascular function.